Hello everyone, I'm Dr. Monica. Today's video will be on risk factors for periodontal disease. So let's begin with the topic. Now let's first understand the terms risk and risk factor. Risk here is defined as the probability that an individual will develop a specific disease in a given period. So in simple terms, risk is a chance of getting a disease, whereas a risk factor is an environmental, behavioral or biologic factors that when present increase the likelihood that an individual will develop the disease. That is, risk factor is an contributor or it is the predictor of a disease. Their presence does not confirm whether the person has a disease or not, but they increase the probability of that disease. So let's understand the various risk elements for periodontal disease. Coming to the first factor, that is risk factors. So these are modifiable and they have been scientifically proven to increase the disease risk through longitudinal studies. So they are true contributors to periodontal disease, and for any factor to be considered risk factor, exposure must occur before the disease onset. Next we have is risk determinants. So these are unchangeable factors like genetic, age and gender. They don't cause the disease directly, but they affect how likely someone is to develop it. Next is risk indicators. So these are the possible risk contributors. They are identified through cross-sectional studies but not confirmed by longitudinal research. Next is risk markers. These are signs that suggest a higher risk, but they do not cause the disease themselves. So let's understand the risk factors for periodontal disease. The first one is the tobacco smoking. So tobacco smoking, it increases the chances for developing periodontitis regardless of age or how well someone is maintaining the oral hygiene. Smokers also tend to respond less effectively to periodontal treatment as compared to non-smokers, and smoking also reduces the success of treatment and healing. So next risk factor is diabetes. Both type 1 and type 2 diabetes, they are linked to a higher risk and severity of periodontal disease. Poor blood sugar control worsens periodontal health and slows healing. So coming to the next risk factor, which is microbial factors. So specific bacteria, they play a key role in periodontal disease. For example, aggregatibacter actinomycetin comitans, they play a key role in aggressive periodontitis, whereas Porphyromonas gingivalis, Tenderella forsythia, they play a key role in chronic periodontitis. So it's not just how much plaque is present, but the type of bacteria in that matters the most. So next risk factor is anatomic and restorative risk factors. In this, certain tooth shapes such as furcations, root concavities, developmental grooves or enamel pearls, and faulty restorations such as overhangings or subgingival margins, they tend to increase the plaque retention, thereby leading to inflammation and bone loss, and it raises the risk of periodontal disease. So next is risk determinants or background characteristics. So first one is genetic factors. So genetic composition of an individual, they influence the susceptibility to periodontitis with altered immune responses linked to severity of periodontal disease, which is seen in twin and familial studies. So coming to next risk determinant, which is age. Periodontitis severity, it increases with age, mainly due to cumulative exposure to risk factor. Early attachment in young patients, it is more concerning with aggressive forms often linked to genetics. Younger onset, it indicates higher long-term risk. So next is gender. So we often see that men show more attachment loss as compared to female due to poor oral hygiene and not because of genetics. So coming to the next risk determinant, which is socioeconomic status. So lower socioeconomic status is associated with poor oral hygiene and limited dental care, but it is not an independent risk factor for periodontitis when other factors are considered. Now coming to the next risk determinant, which is stress. Stress can affect immunity and hormones, increase risk behaviors like smoking, worsen periodontitis severity, and reduce treatment response, making it a potential risk factor for periodontitis. So now let's understand various risk indicators for periodontal disease. First one is HIV or AIDS, which causes immune dysfunction leading to increased risk of periodontal disease. HIV positive patients often show severe destruction like necrotizing ulcerative periodontitis, with greater pocket formation and attachment loss due to immunosuppression. So coming to the next risk indicator, which is osteoporosis, which reduces the bone mass and may increase periodontal attachment loss, especially in women. But the evidence is mixed and further studies are needed to confirm this link. Now let's talk about risk marker or predictors for periodontal disease. First one is previous history of periodontal disease, which is a strong predictor for future disease. So patients with severe attachment loss, they face higher risk while those without past periodontitis have lower risk. So next risk marker is bleeding on probing. It is the best indicator of gingival inflammation. It alone cannot predict the attachment loss. So presence of bleeding on probing, it increases the pocket depth and it is a good predictor of future attachment loss. Absence of bleeding on probing, it is an excellent indicator of healthy gingiva. So coming to the clinical risk assessment for periodontal diseases, which includes demographic data, including patients' age, gender, lifestyle, socioeconomic status, dental awareness, preventive practices, frequency of care, duration of exposure to risk elements, postmenopausal women, and signs of aggressive disease. Medical history, which includes presence of diabetes, HIV or AIDS, osteoporosis, use of tobacco, or stress. The dental history includes family history of early tooth loss, genetic risk for aggressive periodontal disease, and previous periodontal problems, and how often the patient receives dental care. Coming to clinical examinations, we check for plaque, calculus buildup, bleeding on probing, extent of loss of attachment, any presence of aggressive forms of disease, complete tooth examination, and check for plaque retentive areas or anatomic factors, restorative factors, and if needed, microbial sampling of putative periodontal pathogen is also done. So whenever a patient visits for periodontal treatment, we first take the medical and dental history, we do the periodontal examination, then identify the risk factor or risk determinants. After this identification, we perform either non-surgical or surgical periodontal therapy. And after the therapy, if there is positive response, we go for appropriate periodontal maintenance. And if there is negative response post therapy, we reassess the risk factors or determinants of the patients. So now let's talk about periodontal assessment tools. So these tools help evaluate a patient's risk and severity of periodontal disease in an objective and structured way. Few examples include paid oral assessment tool. It assesses 23 clinical parameters scoring from 1, that is low risk, to 5, which is high risk, to give a quantitative risk profile. Next is PEMBRA. It is an electronic tool that integrates clinical evidence, patient data, and professional expertise for treatment planning. Please like and subscribe this channel if you have liked the content. Thank you.